Thank you, Governor. Good afternoon. To get started with the data updates, as the Governor said, we have 277 new cases for today. That's a reflection of the expanded testing that we've been able to do. This brings our total to 1,727 cases. And as the Governor also shared, we sadly have 8 additional fatalities to report today. We now have 43 COVID-associated fatalities total. The age range for these 8 people was wide. There was one person in their 20s with underlying illnesses, one in their 40s, one in their 50s, one in their 60s, one in their 70s, one in their 90s, and there was one person in each of those categories, as I've shared, with 2 people in their 80s. In addition to sharing that data update, I want to make a few other notes. The Governor talked about isolation. We oftentimes are referring to isolation and quarantining. As I continue to talk about isolation, isolation refers to staying at home when you have symptoms. Quarantining is when you're staying at home and you don't have symptoms, but you are staying at home to monitor yourself for symptoms. Both processes require staying at home. With isolation, it's important to be able to isolate yourself even within your home to the best extent possible, as the Governor mentioned. So how long do you stay in isolation when you are home with symptoms because you're not feeling well? If you go into isolation because you are feeling sick, you should stay at home and in isolation for a minimum of 7 days. In order to be able to say that you have been cleared of your infection, whether COVID-19 or otherwise at this point, on top of staying at home for a minimum of 7 days since the time your symptoms started, you also need to be fever-free, have no fever for 72 hours. That's at least 3 full days without the use of any fever-reducing medication. And all of your symptoms need to have resolved completely. If that happens, all of those things happen within that 7 days, then that's the minimum 7 days time frame. If it takes longer, then you need to continue to stay at home until you've had at least 3 days with no fever, without taking any medications to prevent fever, and you need to have your symptoms have resolved during that time frame as well. We know that isolation and quarantining, staying at home, not leaving for any reason, having someone else go to get groceries for you if you need to, or other essentials, you should not be leaving. We know that that's not easy. As the Governor has shared, we are working very hard to get help to people if they need it. We particularly know about our seniors, or those who are homebound, or those with differing abilities. We talked last week about Rhode Island Delivers. Please make use of their website. Rhode Island Delivers is how you can get connected to groceries, home supplies, restaurants, mutual aid groups, and many other resources. And you can access it at www.ridelivers.com. I'll again reiterate what the Governor said, really only reserve it for if you need to, so that the people who truly have no other option, there isn't someone else who can go obtain groceries for them, or they are completely on their own, there aren't any family members in the area, we want to make sure that those people really receive the help they need. And if that help is needed, it can be obtained through RI Delivers, and you can call 211. We know also that people need support from their employers if they are in isolation or quarantine. I want to thank the employers the business groups who are out there. I'm honored when I'm able to join in on the regular conference calls with business owners. We appreciate your willingness to be patient and to be flexible. If one of your employees is on quarantine or isolation, they cannot be at work. Separately, I want to also talk about the testing that the governor referenced. Testing continues to be available in an expanded way if you have symptoms. If you do have symptoms, please make sure that you call your provider, you call an urgent care center, and go ahead and get the testing that's needed. No one should be showing up at any of the facilities for testing. I also want to speak to our populations who we know may have challenges actually driving to the places to be tested, or challenges being able to really access the testing because they're homebound. Know that you are a priority. We have a team of people working on how to better address that. I want to credit the governor. She's been on the phone with federal leaders on a daily basis, looking to get access to additional point-of-care tests so that we can make it available, particularly for the vulnerable populations that we have prioritized that need it. People who may not have mobile transportation, people who may be homebound or may need some other services or challenges or live in a congregate settings. We have that prioritized to be able to address, and we are going to continue to do that. I also want to make a clarification on the cloth face coverings that we have been talking about for members of the public. We've received appropriate and helpful questions about children and cloth face coverings. Cloth face coverings should not be worn by children who are younger than 2 years old. They should be worn by everyone else when in public. They are especially important for members of our critical infrastructure workforce, such as law enforcement, firefighters, people who work in the food industry, people in critical manufacturing fields, and healthcare workers. As a reminder, healthcare workers in hospitals and nursing homes should be wearing medical masks while at work, not cloth face coverings while at work. Cloth face coverings are particularly important for people when they are in places where at times it can be hard to stay 6 feet away from other people. One example is the grocery store where you have to pay a cashier. Another example is when you're getting handed takeout food or something else you are picking up. I want to express the importance of still looking to be creative during some of those times. There are ways that someone can drop something off if it's food or something that needs to be delivered while the door is still closed, and then have the agreement that after that person steps away, you can open the door and pick it up. There are ways to be creative, but particularly where there are moments when that is challenging, that is why it is helpful to always have the cloth face coverings in place. Lastly, the governor spoke about the Adult Corrections Institute, the ACI. I really want to publicly recognize and thank the ACI leadership, Director Trish Coyne-Faig, as well as Dr. Jennifer Clark, who is the medical director there and a beloved colleague as well. Dr. Clark and her team at the ACI have been doing tremendous work to help keep people who are incarcerated there healthy and safe, as well as the same for the correctional officers and other critical staff who we appreciate and are working there as well. Dr. Clark is almost daily in contact with our clinical team at the Rhode Island Department of Health, and we are enormously appreciative of her efforts, Director Coyne-Faig, and the entire staff who are dedicated to doing the work that they're doing at the ACI and across the Department of Corrections.